Hi everyone, Dr. Hall here. I'm just going to introduce you to the scapular region, and then there will be a separate video for doing the muscles and structures. So I have my Halloween skeleton here, and I just want to show you how the scapulas are sitting on the posterior ribs. So that's really important to keep in mind. So the anterior surface of the scapula is actually sitting on those ribs. We can also see the spine of the scapula, which comes out to the acromion, and we can see the glenohumeral joint between the glenoid cavity or glenoid fossa, which is the socket, and the head of the humerus here for the shoulder joint. You can also see how the acromion comes around and articulates with, the clavicle. So it kind of forms a C, and I think you can kind of see how the acromion is coming around and articulating with the clavicle. So that's the AC, or the acromioclavicular joint there. So that's going to be important to us as well, because there's some structures that come through here in that space. Now, this model doesn't do a good job showing us the structures of the superior scapula. This is kind of, they went rogue on that. So I'm going to show you a plastic model of an actual scapula. So the scapula is one of my favorite bones because it has lots of different accessories on it. So if we look at the anterior surface of the scapula, which would be sitting on the posterior ribs, we can see the coracoid process here, which we'll remember is the insertion of our pec minor muscle, which comes down and attaches to ribs 3, 4, 5, as well as the coracobrachialis muscle. So that's that coracoid process. We can also see this notch here, this suprascapular notch, which is going to be important today. The superior angle and inferior angle, this is the medial border where we'll remember our rhomboid muscles attached. And if we look on the posterior surface, as we move in that direction, so here's the acromion, which is the end of the scapular spine, right? And that's going to articulate with the clavicle. And here we can see that shoulder socket, that glenoid cavity or glenoid fossa. When we look at the posterior surface of the scapula, we can see the scapular spine now, and you'll see it starts off flush with the blade of the scapula and then kind of rises and kind of ascends outward. But there's this little space here, and that's going to be important for us today as well. So again, superior angle, medial border, inferior angle, lateral border, glenoid fossa.